Hi, it's Dr. Chris Sear, Chief Medical Officer for Telecare, and today I wanted to talk to you about how to avoid patient complaints and Medicare audits. As you know, at Telecare, we've recently changed from a predominantly bulk billing to a mixed billing model, and we have had some patients refuse to pay as they were not satisfied with their consultation. One dissatisfied patient is, of course, a relatively minor problem. But my concern is if this patient complains, it could trigger a much larger issue. So, what is the Professional Services Review or PSR scheme? The PSR is a process through which practitioners are investigated for potential breaches in Medicare billing. It involves a peer review process of a random selection of cases to determine whether billing practice was inappropriate. A PSR audit can be triggered in multiple ways, one of which is random screening, but a more common way is by auditing outliers. If you are in the highest 1 to 2 percentile for your specialty for an item number, you are at high risk of being audited. Finally, a tip-off or whistleblower can also trigger an audit, and this is especially relevant for patient complaints. So let's have a look at a few recent PSRs. A cardiologist was referred for audit as for item numbers 110, 117, and 133. He billed these in excess of 98% of his peers. The findings of the audit were that the services were not complex enough to justify complex item number billing and that minimum time requirements were not met. Additionally, his records were inadequate and not all investigations were clinically indicated. This cardiologist was ordered to repay a whopping $550,000 and was disqualified from providing MBS item numbers 117, 132, and 133 for the next 12 months. Similarly, a rheumatologist was ordered to repay nearly $1 million, and a hematologist was referred because he was the highest user of 132 and 133 item numbers among hematologists in the country, and he was ordered to repay $330,000. So of course, this is what we're trying to avoid, and prevention is always better than the cure. So how do we avoid getting audited in the first place? Well, one thing we can do is try not to bill complex item numbers excessively in excess of what your peers are doing. Another important thing that we need to do is to avoid patient complaints and tip-offs. So how do we avoid these patient complaints? One of the more common complaints that we've received at Telecare is an inadequate consultation length. And I'd suggest sticking to a minimum consultation length of at least 10 minutes. I acknowledge that sometimes you don't need 10 minutes to complete all you need to do, but I do think 10 minutes is a good number to have in the back of your mind, as from my experience, that's about the length of time after which patients feel that they have received an adequate amount of care and attention. If you do need to stretch out the consultation, feel free to write your notes, do all your prescriptions, order the tests, and even write your letters with the patient on the line with you to increase that consultation time. Another thing that you can do is to take the time to explain your thought process to the patient and explain the disease process to the patient rather than just focusing entirely on the management plan. I have found that often patients who are paying a gap do like to understand a bit more of their disease process and do really appreciate this. Now, despite all that, if you do feel the need to end your consultation early, and sometimes you will need to do that, I like to ask my patient a combination of a few questions just to make sure they're completely satisfied with the consultation and that they have had all of their issues addressed. And these are: is there anything else I can help with? Do you understand the plan? And do you have any questions before we finish? So I think if you ask a combination of these questions, you can be certain that the patient is satisfied with their consultation. Finally, another complaint we did receive is specialists not wearing the appropriate attire. So even though we are doing a lot of telehealth consultations, please bear this in mind that you still need to look presentable. Now, worst case scenario is you are referred for an audit, and these are the things that I'd suggest to protect yourself. Firstly, build the correct item number, and it's important to realize that for time-based item numbers, it is patient-facing time, so you cannot count time writing a letter or doing things with the patient not present. So if necessary, write your letter, order the pathology, order the prescriptions with the patient on the line with you, so it counts for that time-tiered item number. Additionally, for complex item numbers, only use them for complex cases. This is a recurring theme in the PSRs, where the cases were not of sufficient complexity for complex item number billing. Another theme that came up in the PSR reports was the lack of adequate and detailed records. Also, it's important to keep contemporaneous records, which means writing your records or your notes as soon as you've done the consultation. Avoid over-servicing and avoid billing Medicare for things that aren't Medicare rebatable, like pre-work medical assessments, life insurance, or superannuation assessments. So really, that's all I have to say today. Please keep your patients happy. It will avoid so much trouble in the future. Make sure they're satisfied with your consultation. It's something that we all have to work a little harder now that we are moving to a predominantly mixed billing model. So stay safe, and I hope you enjoyed the video.